Hi, I'm John Lamott from the Central Ohio Area Agency on Aging. Welcome to our series, Medicare for Beginners. In this segment, we will be talking about Medicare's Part B program and how it works. Before we begin, here is a brief overview of Medicare. What is Medicare? Medicare is a federal government health insurance program. It provides coverage to persons who are age 65 and older, and also younger persons who may be receiving Social Security disability benefits, or persons who have end-stage renal disease which requires dialysis or a transplant. Medicare recipients must be a U.S. citizen or an individual lawfully admitted for permanent residence into the United States who has resided in the United States continuously during the 5 years preceding the month of the application for Medicare. There are two options for Medicare coverage: Original Medicare, which includes Medicare Parts A and B, or Medicare Advantage plans. There are additional video sessions like this one that provide information about Medicare A and Medicare Advantage. Medicare Part B is not financed from Social Security taxes that workers pay. Approximately 75% of the program's cost is paid by the federal government. The remainder comes from a premium that is paid by all program enrollees. Medicare Part B does not pay for inpatient hospital coverage. It provides coverage for doctor services in and out of the hospital, many medical services provided outside a hospital or on an outpatient basis at a hospital, preventive care facility, and durable medical equipment such as wheelchairs. It generally does not provide coverage for prescription drugs. Medicare Part B does not provide coverage for long-term custodial care in a nursing home, nor for most dental, routine vision, and hearing procedures such as hearing aids and glasses. Medicare Part B does not have preferred provider networks, but can pay for any expenses at any provider that accepts Medicare for payment. Medicare Part B does not provide coverage for services outside the United States. The standard Part B premium is $135.50 per month, but individuals with higher income may pay higher premiums, as much as $437 monthly. Higher premiums can begin for individuals who have an annual income of $85,000 or more, or married couples whose income is $170,000 or more. You can enroll in Medicare Part B during the 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. Penalties and delays in enrollment may apply if a person enrolls after age 65. Some folks who have employer-provided coverage, however, may delay Part B enrollment without a penalty. Contact the Social Security Administration to enroll in Medicare Part B. Applications may be filed online at Social Security's website, www.ssa.gov, by making an appointment at Social Security's toll-free number, 1-800-772-1213, or by visiting your local Social Security office. If you elected to receive Social Security or regular retirement benefits before age 65, enrollment into Medicare will be done by those agencies automatically. To learn more about Medicare, we invite you to attend one of our free Medicare for Beginners programs held monthly at COAAA. Look for other segments in this series where we will discuss the other parts of the Medicare program. There are also resources on our website, www.coaaa.org.
The Central Ohio Area Agency on Aging supports people as they navigate the experience of aging or disability. We connect people with services that help keep them safe and healthy at home, such as homemaking assistance, transportation, home-delivered meals, and personal care. We offer education and resources to caregivers, professionals, and the public, and advocate for programs and policies that benefit older adults and individuals with disabilities.